was just recently World Stroke Day in awareness of this serious medical condition. Stroke is something you cannot ignore. A place that helps is the Quad Cities Rehab Institute, where Dr. Ramavaram is the medical director, and then Maddie Bevill is a speech-language pathologist who's also there at the center. Good to have you both here today.
Thank you.
Talking about this very important thing. Doctor, let's start with you. What exactly is stroke?
So stroke is basically a change in blood supply to a part of the brain, whether it's a decrease or an extreme increase in blood supply where it's a bleed. So it's a diminished or increased blood supply where you have a bleed, or an ischemic stroke where you have a decrease.
It's a thing in the brain. Is it related at all to the heart?
Yes, it actually can be related to the heart. There's different parts of the body a stroke can originate from. Heart's one of the big risk factors. Cardiac issues is a big risk factor for sustaining a stroke, yeah.
Well, Maddie's here today because a big part of some strokes is that when people suffer some kind of a language problem afterward.
Yes.
So do you give them rehab for this, or where do you step in, Maddie?
We do. So part of the deficits that come with a stroke, patients can get diagnosed with aphasia, which can be a language deficit, both expressing and understanding language, the world around you, and then cognition as well. So being able to problem solve, keep your attention while we're having a conversation. And a big one too is swallowing deficits that people aren't always aware of, so it can result in modified diets, things like that. So we have rehab for all of it.
Well, we also know the stroke can be fatal. Yes.
Yes.
How often? What are the chances of that, doctor? Do you find in stroke patients that they can't recover?
Well, there's U.S. has about 800,000 strokes a year, and about 2/3 of the patients need rehab. So a big chunk do recover. Very rarely do they die very rarely do they actually completely die from a stroke.
What are the symptoms, the early symptoms, when you know you're in trouble?
The big things that people should watch out for is when they have that facial droop, trouble speaking, when they are having falls, difficulty with coordination, balance, when they're acting confused. Very common actually in the older population.
Sudden confusion, like all of a sudden they're not right.
They're just not the same, exactly.
Okay. All right, so then you should do what?
When you feel like someone might be sustaining a stroke, the first thing you need to do is call 911. The most important part is it's time sensitive because they need to get to an ER where they image this patient to see what type of stroke they've sustained.
What is the time period that's crucial?
That first couple hours, because depending on the type of stroke they sustained, if it's an ischemic stroke where they have a clot, reduced blood supply, you could do what's called TPA, that you could push for patients to bust the clot so the blood supply can get back.
So you could fix that?
You could fix it if you have it in a timely fashion. So you have to get the patient to come over to the hospital within the first 5 hours, 4 to 5 hours.
So you don't just go to bed and ignore it.
Absolutely not. If that's one thing I can say, if you're concerned, I'd rather you err on the side of caution and get yourself to the ER.
Yes. And how often, Maddie, do you see great success when it comes to the rehab for speech and language issues?
We see great success with our patients. We have a lot of different therapeutic approaches that we take with our patients. It kind of depends on what their deficits might be, but at the Quad City Rehab Institute, we see great successes with our patients and, getting them back to their daily life and functions and, just living their best life the best they can.
Well, that's the most important thing, right?
Yes.
And would you say the methods have changed, Maddie? I'm going to ask you that first. Compared to having a stroke, I don't know, 10 years ago, 20 years ago.
Yeah, I think with speech therapy and physical and occupational therapy as well, we take a very multidisciplinary approach where I think before it might have just been a singular therapeutic approach. And, speech therapy is a relatively new-ish realm that people don't always think about, but we play a very big role in that stroke recovery process.
And you two really work together, and with your whole team.
We really do work together.
We do.
Absolutely do. Yes, the girls are ruling here now. Quad Cities Rehabilitation Institute in Moline. Yes, and you know, come one, come all, right? There's all the information that we have for you on screen.
Yeah.
Good to have you both here. Thank you.
Yes,
for what
thank you
you've
so
done.
much.
You made a difference in a lot of lives, so that's very meaningful.
Thank you for having
Yes,
me.
thank you.
Nice job, girls. When we come back today, a PSL vintage video for you. We're throwing it back 18 years to the home